Welcome to Real Money Talks. Real strategies from the moneymakers and the world changers that you can use to make millions, keep those millions, multiply your wealth, and build your team. Here's your host, author of 5 New York Times bestsellers, money expert on Dr. Phil, CNN, CNBC, The Street TV, Fox News, and The View, Loral Langemeier.
Hey, this is Loral, and welcome back to Loral's Real Money Talks, the podcast that talks about that, money, business, and success. Every Friday, I bring you a guest to talk about what they're doing, not only impact the world, but also just to make money, how they do it in different practices, different businesses, and just the impact and success they're making. So today I have Al Pirnia with me. I met him a few weeks ago by Patrick Porter, as many of you know, our Brain Tap master of all. He's always at our events, just so you know, Al. He's been at our events for years. Most of our community has Brain Tap by now. And Al is the founder and CEO of EverHealth Inc., an innovative preventive and wellness company. He helps really those with functional medicine practices get more integrated. And we're getting more and more functional medicine doctors. Just had Dr. Gladden on the podcast, and want to bring it to you because we're bringing you obviously things like make your kids millionaires and generational wealth. You need to live longer and healthier. So Al, welcome to our show.
Oh, thank you, Laura, for having me. Really excited to be here.
So tell me how a biochemist, an engineer, walks all the way over to helping thousands and thousands of clinics become amazingly successful.
Yeah, it's a funny story. I got my MBA, went into finance, worked with the chairman, vice chairman of Shearson Lehman Brothers, American Express for many years, and realized that's not my passion. Educationally, I had a bachelor's in chemical engineering, biochemistry, and by chance, I got recruited to run a company that had grown so fast they couldn't manage their business. They were a nutraceutical corp out of Canada. And in the process, I realized that's where my roots is. That's where my passion is. When I left that company after I got them to where they wanted to get to, I thought, well, the internet's becoming accessible. And what we really need to do is make these physicians more integrative. So I started a company called Natural Health Inc., thinking I can couple the internet with physicians and really start getting society to become proactive with their health. And the internet wasn't ready. The physicians weren't ready. Nobody was ready. But I raised a lot of money. I got a lot of smart people working with me. And by the time we were done, we realized what we have to do. And after all these years, we've created a network of thousands of functional medicine clinics with programs they're using with their patients to empower them to take control of their health and become proactive and preventative.
I love it. So you have a passion, obviously, for the healthcare system, which is, having just interviewed Dr. Gladden, I love he calls it the sick care system.
Yeah.
So having it become more preventable. So talk a little bit more like when you said that was like, the well side and some of those weren't your jam. How did what's your passion about this? I mean, when you think about medicine and you think about what you're doing with the clinics, what keeps you engaged?
Well, I'll just give you 3 numbers to take into consideration. 4 numbers. One is that in 1960, 5% of our GNP went to healthcare. Today, it's almost 20%. Most, if not all, that money is going to sick care. Our system is waiting for people to get diseased, and then we manage them for the rest of their lives. A third of the senior population are on 5 or more meds. Almost 40% of the population is diabetic or pre-diabetic. It's projected that 1 out of 2 Americans are going to be, at some point, going to get cancer. This is not a sustainable healthcare system. The whole model is basically bankrupting everybody, including the government. So we have to, as a nation, do something. And what I've put my life into is to get physicians and practitioners to have the tools to help empower their patients to take control of some of the main drivers of disease, like elevated blood sugar, unhealthy body composition, and unhealthy lifestyle. So that's what we've been doing for almost 20 years, and we've had amazing success getting these clinicians to empower their patients to take control of their health.
So what are some of those tools or strategies that make that possible?
Well, I mean, we have this concept called the Health 100. These are 100 companies that have technologies that we feel is changing healthcare. Now, I'm not talking about curing a disease. I'm talking about trying to prevent a disease, correct imbalances before they become a disease. Unfortunately, our healthcare system has not changed in 50 years for the average American out there because they're still seeing their doc once a year with a 20-minute visit and a blood test and either a drug or a surgery. Whereas everything in their life has changed with technology except for that experience. So what we're trying to do is tell our practitioners, you need to become a top technology HP being a health practitioner. And if you use at least 25 of these, what we call Health 100 technologies, you can become a top technology HP, and we help them get the word out in their community, get society to know they exist, learn about some of these technologies that can make a huge difference in people's lives. Now, I'll give you a couple of examples.
I was just going to ask, I want to know, like, give us,
Yeah. So let me give you a few examples.
Do you have the list of 100 somewhere?
We do. If you go to Health 100, 100 being a number, collective.com, you'll see they're listed right there, health100collective.com. But let me give you a couple of examples.
Yeah.
The number one killer in America is heart disease. Now, the average cardiologist is going to look at your cholesterol and say you've got very elevated cholesterol, and we want to put you on statin drugs. The problem with that is that half the people who die from a heart attack have no cholesterol problems. So you can't say that cholesterol is the main driver when half the people don't even have a cholesterol problem. The real problem is plaque. And when plaque forms and at some point blocks the arteries, we have a heart attack or we have a stroke. Now, imagine we have a test, a blood test that insurance even pays for, that gives you a risk profile, mild, moderate, high risk, that you have a blocked artery. And then if you do come back with a high risk that you have a blocked artery, if you have a simple supplement that has got decades of studies from Japan and other countries that gets rid of plaque. So imagine you find out you've got elevated risk for a blocked artery. You take a supplement, and after 6 months, you take that test again, and you find out you're no longer a high risk. How fantastic is that? That's the kind of technology I'm talking about. Give you another simple example. We all know how devastating mold can be. You find mold in your home, you find it in your office. What if there's a simple gadget you can take in your home and see if you got mold? I mean, I can go on and on and on. There's so many technologies.
Go on, do a few more. Those are fun.
Yeah, I mean, give you an example, diabetes. I mean, we have almost half the population diabetic or pre-diabetic. The pre-diabetics are literally ticking bombs to become a diabetic, and nobody's even, addressing the issue. We just say, well, wait until you're a diabetic, then we'll give you metformin. And metformin, what does it do? It just delays the process. After a couple of years, you got to go from 500 milligrams to 1,000. Then you add another drug. Then you start adding insulin. Then you have the complications. It's a disaster. At that early stage of prediabetes, it is so easy to reverse that condition. I mean, there's government double-blind studies showing how simple it is, but we ignore because there's so much money in that business of managing diabetes. So it's just a sad situation because we're playing with people's lives, we're destroying people's lives, and what's worse is we're paying everything out of pocket. These $5,000 deductibles, everything's out of pocket. Half the bankruptcies have to do with catastrophic. People really don't have insurance anymore. The real insurance is prevention. That's why we're so passionate about trying to empower people to take control of their health, become proactive, become preventative, correct imbalances before their disease conditions using these Health 100 technologies. And what we call a top technology HP, a practitioner is using at least 25 of these technologies in their practice.
I love that. And so when you work with them, is there lots of training that all these practitioners need to do, or how do they become one of the, these top technology HPs?
The top technology HPs, we give them this list of the Health 100 Collective, the 100 technologies we feel are warranted, and they can make a huge difference. And they pick and choose what they feel excited about. We have recommendations. There is what we call the 360 process that literally in 10 to 15 weeks can create a new person and how they look, feel, function, and think. But they decide what they want to offer in their clinic, and we train them. We do everything is in-house. They don't have to go anywhere. A lot of the technologies is staff driven. A lot of these clinicians, don't want to do more work. They want to do less. So we've designed them so that the practitioner can train their staff, or we train their staff. And we even help drive patients into their clinic, because there's so many people out there who are diabetic, pre-diabetic, want to lose weight loss. I mean, weight loss is a huge business, and it's a business because everything that's offered is really a Band-Aid. If you're doing meal replacements, or right, what's hot right now, the Ozempic. I mean, you're taking a drug, you're taking all these calorie counting systems. None of them empower you to be able to succeed over time. It's a program that as long as you're doing it, you're successful. As soon as you stop, you go back to where you were, and you've done more damage because you've lost muscle mass in the process, and now you got to even eat less than you did before. So to have a technology that really empowers people to maintain success, maintain weight loss, maintain blood sugar control, maintain the ability to have healthy arteries, circulation, these are the things that we bring to these clinics, get them excited to start working with their patients, where their staff can administer and even drive people that need these kind of services.
So what qualifies those top 100? Because I would assume those would be, I'm out here in Shark Land, right? Love investing in different projects. I do fintech, but I haven't done biotech or medtech or anything like that. So what qualifies those 100 to get on that list in that collective?
It's changing every year. We have a conference once a year in Dallas. It's called Changing Life and Destiny. If anybody wants to learn about it, they can go to changelifedestiny.com. As a special for being on the show, they have a very discounted early bird price if they wanted to join us. But at this Changing Life and Destiny conference once a year, we showcase what we call the Health 100. These are 100 companies that we feel is changing healthcare. So every year, we may have new ones. We may have some who stayed on from the previous year, but we try and pick and choose a variety that can address a lot of issues, from neurological issues to these physical ones to just lifestyle. The idea is to bring together in one setting the top 100, because when you go to a lot of these conferences, there's like 400 booths. Duplicates of everything's out there. It's a football field size. People are going to classes. They're running in for an hour here, running in for an hour there. They don't have the time to really take the time to understand what's there. Our conference is designed to give the practitioner a real good snapshot understanding of what's available, and not waste their time with 10 of the same things, and give them some education around these technologies with workshops and presentations. So by the time they're done over 3 days, they can go back into their clinic and understand how to start implementing some of these in their practice. So every year we showcase the Health 100, and practitioners come there and decide which ones they want to start working with to become a top technology HP, because there's so many benefits that we give them if they become a top technology HP.
So I have a lot of clinics and functional medicine docs, in my world that I'm helping set their corporate structure, reduce their taxes, and help them grow. So speak to them, like when you say you give them a lot of extra incentives when they become a top tech HB, speak to that section, because I know there's a bunch of them that will listen to this podcast. What do they get? Because I'd love for them to go. And by the way, I want to be part of the wealth part of this expo, because everybody's going to be handling money as they go through this expo. So I'll just give another plug for the Changing Life and Destiny. He's got a $99 special. So those of you who want to meet us in Dallas, I'll be there with Al, and love to see you there. But what if I'm out there and I'm one of those practitioners? What's their benefit? What's their process to become a top technology HP with you?
So Laura, if they become a top technology HP, which is really not complicated, to have 25 of these technologies, it could be simply a gadget that can help their patients point out if they've got mold in their home. It could be a simple supplement that can get rid of plaque. It can be a blood test that shows somebody's got a blocked artery. So it's not difficult to become a top technology HP, but the benefits are amazing. We give them what we call the 4x4 matrix, 4 ways that we drive patients into their practice, and 4 platforms to educate those patients before they even come into the clinic. See, the biggest problem right now in technology in the health space, there is so much. Mm-hmm. The question is, who is going to sit down with every patient that walks in the door and spends 2 hours saying, look at this, look at that, and answer their questions? Yeah. Nobody has the time. The practitioner certainly doesn't, and their staff probably aren't qualified. So what we've done is we've created 4 platforms that does this for the practitioner. The first platform is just a hard copy magazine of what we call the top technology HP. So all those technologies they've decided to offer is in this magazine, just a paragraph, but it has a QR code. So if they want to learn more, they can. Then what we do is we put that onto their website. We have a flip magazine on their website. People can flip through it. And then we have a drip email system that allows us to educate every week their patient base with one of these technologies, because a clinic may have active 200, 300 patients, but they may have 2,000 or 3,000 in their database who aren't coming into the clinic. In this way, every week we send them an information on one of these technologies, and that could bring them back for some service. But the final one, the most exciting platform to educate patients, is a metaverse clinic. A metaverse clinic is a paradigm shift. Just like AI is a paradigm shift, the metaverse clinic is a paradigm shift in how people are going to be introduced, educated, and handheld on technology in health. And we're the first company that are creating this for practitioners, where before somebody comes into the clinic, the first thing they're going to do is say, go to my clinic on the metaverse. They'll give them a link and they get a tour. That tour will be more effective in the education and information that's given to them than the practitioner sitting with them for 3 hours and trying to speak to everything they have to offer. So what we give the top technology HP is the 4x4 matrix. 4 ways to bring people into the clinic, 4 ways to educate them before they even speak to the practitioner.
I love that. So I want to dive into a few places. So to your point, right, just met at an event together where there was a lot of technologies. I mean, I saw people walking out with $100,000 they spent on all sorts of things. So in your opinion, because you've been doing this and you pick top, let's talk a few places. So let's talk about water. So in the water world, right, there's this whole world that says alkaline water is great. I just learned about hydrogen water. And then there was another kind of water. So, and I don't even remember what that one was. So
oxygenated one.
Is what?
Maybe it was oxygenated water.
Yep, that probably was. Yeah. So how does someone pick, like even in the water space, to your point, there is a lot of technology. It is confusing to a lot of just, lay people who don't know. And I see, people trying all sorts of, like you said, shiny objects. So how do you know what's the best?
Well, that's part of why it's so important for practitioners to come to a conference like our Changing Life and Destiny. On Friday, from 9 to 4, we just have workshops on all the technologies that are there. We have 45, 50 workshops going on throughout the day in different rooms. So people can pick and choose what they want to go and listen to and learn about what is hydrogenated water, what's oxygenated water, what's the purpose of alkaline water. They can make those decisions and really truly get educated. Everything is recorded, so if somebody doesn't have the time to go and listen to everything, that's almost impossible because multiple rooms are going on at the same time. We record everything and they can go online and sit and watch and learn. So part of this is really educating the practitioner so they understand why somebody potentially could want this versus that, and they make the recommendation.
Interesting. Talk about neuroscience in the brain, dementia, Alzheimer's.
Yeah, I mean that's
fast. Where does that compare to heart disease and diabetes that you spoke of? I mean, it's got to be right up there in the top.
it is. I mean, it's not like almost half the population, but it's growing very, very rapidly. And again, it's one of those situations where traditional medicine really has no solution for Alzheimer's, dementia. All the medication they have really doesn't work. The key with this is early detection. If there's some wonderful technologies that allows us to really understand what's happening neurologically. One of them that I'm very familiar with, because I had a brain injury about 25 years ago, is brain mapping. You can brain map 19 points on the brain, and each one of these points reflects on behavior. It reflects on whether there is good blood flow, or there's good conductivity. And if there is a problem and you catch it at that early stage, there are many tools that you can use to start reversing the condition, at minimum, not letting it advance. And I've had this personal experience. When I had my brain injury, within a few years, I started noticing I'm not as articulate. I starting to have memory issues. By chance, I got introduced to this whole brain mapping. I went through it. I did the neurofeedback. I did some neurotransmitter testing, and started taking some really amazing supplements. And 25 years later, I'm great. I don't have any problems. I am convinced, 100% convinced, that if I hadn't gone down that road, I would be in deep trouble right now, neurologically. So, that's again the tragedy of our healthcare system. We wait until it's too late, and then we just manage the disease. And unfortunately, that will bankrupt the country and give people a terrible old age experience in life that is unnecessary.
Yep. Well, and then they end up in assisted living or hospice, and I'd say the rest is history. I mean, the number one takedown of wealth is an unplanned health condition. Yeah. And number two is an unplanned generational wealth plan, where the money's just getting fought about with the kids and then it goes away. Yeah. So number one and number two, that's why I was excited to meet a lot of you at Fab's conference and bring you onto the podcast and just get you exposure to our world of wealth builders, because why do it if they're not going to be healthy on this journey? So
I'm sure you've heard of this, Laura. People spend their life making money, and then they spend their money trying to get back their health. They lose their health in the process, and then they try to. We actually have a movement. We launched it at this last conference called Love Your Health. You can see it on my cap here. So what we're doing with this movement is basically telling people we're here as spiritual beings to experience love. And we start off with our family and we go from there. But in the process, what happens is we forget ourselves, we forget our health, we lose our health, and we can't love anymore. So what we tell people is that your number one priority to get to your destiny, wherever it is and whatever you're going to do, is to love your health first. Because without health, you can't help anybody, you can't love anybody, and you can't get to your destiny. And we've created a video that we showed at the conference, and everybody was just, besides themselves, and in the message in 2 minutes, what was said in this video. And what we're going to do is make it available to all our partners, so they can put their name to it and create a movement for society to realize their number one priority in life has to be love your health, and that has to be with technology around prevention and wellness.
I love that. So where can we see that 2-minute video? Because I can tell all of our listeners will want to see it or participate with that.
Yeah, we'll get it to you, and you can share it with whoever you like.
Okay, I appreciate it. Al, it's been great having you. And again, how do people stay in touch with you? Talk a little bit more about your Changing Life and Destiny conference.
Yeah, so the conference is April 12th to the 14th in Plano, which is just 15 minutes north of Dallas. We do this every year. This past April, we had almost 2,000 people there over 3 days. Friday from 9 to 4, we have these workshops. From 6 to 10, we have a red carpet where we celebrate the Health 100. We have a black tie dinner celebrating the Health 100. And then Saturday and Sunday, the expo hall opens with back-to-back presentations from all those technologies, 20-minute presentations giving a little snapshot on what's unique about them. And then people can go to the booths and experience them, talk to the developers and the scientists and people like Patrick, and get to really understand what's there and decide what they want to start offering and working with in their practice.
And for people who are not in clinics, but just kind of lay people who want to see, what's the benefit for them going?
There's really three groups of people who come to our conference. There's the practitioners, and then there's the professionals. We call them HPPs, health promoting professionals, and it can range from biological dentists to a thermography center, Pilates, yoga, fitness. What we do when we establish a top technology HP in a clinic in a territory, what we do is we also partner them with a community of health and wellness professionals. We call these health and wellness professionals HPP. So the HP, which is the functional medicine doc, and the HPPs together become the carousel of wellness for a set territory. And what's really great with this concept is, one, everybody starts referring to one another. The practitioner, the HP, wants to refer all their patients so they can make better lifestyle choices. If you're going to have a dental procedure, try and see a biological dentist, make sure they're not using mercury. If you're going to have a mammogram, try and do a thermography so you don't have all the radiation, and on and on and on. So the clinics that become a top technology HP also get this benefit of being partnered with this community of health and wellness professionals, and they love that community. And so in our conference, we have the HPs, these functional medicine, top technology HPs. We have these HPPs, these health promoting professionals, and we have a lot of corporate people who are into wellness for their company. There's a lot of self-funded, shared funded companies out there. That means they're paying for whatever happens to their employees, and they have a huge financial incentive to keep their employees well. So we do some corporate work. We bring these corporations to our clinics, and we can make a huge difference in reducing their healthcare costs with our programs, with our clinics, with these Health 100 technologies. So they also come to the conference to learn about some of these technologies and decide how they can take it back, working with our network into their workplace.
I love that. I love that. I look forward to staying in touch with you and learning more and being at your conference next year. Those of you, the link to the conference and following Al will be in the show notes below. And Al, thank you.
Thank you. We hope to see you soon. Take care.
And those of you who are watching, again, any questions that you have or requests that you have, go to askloral.com, ASKLORAL, and we'll be back next Friday with another great message.
Thanks for listening to the Real Money Talks podcast. Your host has been Loral Langmeyer, author of 5 New York Times bestsellers, money expert on Dr. Phil, CNN, CNBC, The Street TV, Fox News, and The View. Want to learn more about off-Wall Street investing, tax strategies, and multi-million-dollar business strategies? Visit liveoutloud.com/podcast for past episodes, show notes, and resources. For some special wealth-building gifts only for Loral's podcast listeners, visit liveoutloud.com/podcast gifts. Do you have a burning question for Loral? Visit askloral.com to submit your question, and it may just be covered on a podcast episode. So stay tuned and be sure to subscribe to get new episodes every week.